Merakey is proud to be recognized as a national leader in delivering critical services for mental health, substance use disorder, autism, and intellectual and developmental disabilities. We are committed to providing services for the whole person so that everyone can step into tomorrow with dignity, fulfillment, and growth in their lives.
Within the Merakey Children and Families Division, we provide specialized education, preventative care, and community-based behavioral health, focusing on ensuring that the individuals we serve can stay in their natural setting as often as possible and prevent higher levels of care. The new initiative that we've stood up over the last couple of years that really focuses on prevention of higher level of care is a program called MCRSS, which stands for Mobile Crisis Response and Stabilization Service. And the goal with this program is to prevent hospitalization or rehospitalization. So we respond to an initial crisis call, we go out, we support the family, we triage immediate needs, and from there we provide an additional 8 weeks of stabilization service that includes brief treatment therapy, case management services, and peer support to not only the child but the whole family. And over the last year, we've seen an 80% reduction in hospitalization for the kids that we're serving. One initiative we're very excited about right now is the creation of the Philadelphia Children's Hub, which will bring our current children and family services together into one location and allow us to begin to build out additional services to support the community in Philadelphia.
We started with Merakey when Maggie got out of the psych hospital, and since we've been with Merakey and Halima as our caseworker, we've really had good success with getting Maggie on track so that she learns how to interact in a family and with other people, and that we get the best version of Maggie. We've been so afraid that if Merakey hadn't come in to help us, Maggie would probably be in a group home type of setting, not living with any of us, because we didn't have any clue how we were going to navigate this.
I noticed that Maggie is better able to use her coping skills, and if we have a situation that we are concerned about, Halima comes up with wonderful ideas that will help us to help Maggie at those stressful times.
What Halima and I have worked on is how I can adjust in a normal school setting. She has helped my family because I feel like before her we really struggled with communicating, and now we are able to have a conversation without getting arguing and having beef.
And now Maggie's gonna be okay, and we're gonna be okay eventually doing this on our own, with Halima's phone number in our pocket. But Maggie's gonna do great.
Today, we're here at the Lacebark home, where 3 lovely ladies with various disabilities transition from a facility. We provide 24-hour staffing. The house is adapted to their needs. They each have their own bedrooms, which is personalized. They know that this is their home. This is where they can make choices. This is where they can feel real good about where they are. So I'm really excited about, some of the technology that Merakey is bringing forth. We have the Care Center, which is a medical piece. We are able to provide medical supports to the consumers in their home. We do have some consumers that, struggle with going out into the community, to the hospitals. So having this technology in place is something that has made a huge difference. The staff that currently works here have worked with the consumers for, well over 10 and 15 years. And the fact that they have been continuously supporting these ladies have just added to the fact that they are happy, that they know and understand what the ladies' needs are. It is a family atmosphere. They cook. They provide, various activities for the ladies that they know that they enjoy. The staff has really contributed to the wonderful life that the ladies live here at Lacebark. Each and every time you come in here, you can just feel the joy.
So at Merakey, it is a priority to ensure that the people that we are serving have ease of access to care. We recognize that there are many, many barriers that prevent people from getting the services that they need on a regular basis or staying connected to those services. It is time for us to really reimagine, step outside of the box, and deliver services to people the way that they want to receive services. A prime example of the ways that we are reimagining services is the development of the City of Philadelphia's first adult behavioral health urgent care. The Merakey Mental Health Walk-In Clinic was developed in 2024 in response to a need that the City of Philadelphia had to bridge the gap between traditional outpatient services and more acute crisis inpatient care.
We know that the sooner a mental health problem is addressed, the better the outcome. So when you walk through our doors, you have immediate access to be able to engage in same-day therapy, to be able to talk about a challenge or maybe even a traumatic situation that just occurred. You also have access to peer support, so somebody can kind of guide you through our process and the system. We also, of course, offer psychiatry support so that if medication is something that would be beneficial to you, we can get you that, get you started on your meds here, same day. The idea here is that we're going to wrap services around the person and get them on their path to recovery as quickly as we can.
So the work is important to me because this is my community and this is where I grew up, and I like to give back to my community and be there on the worst possible days of someone's life and let them know that someone is listening, not only from a mental health aspect, but from a medical aspect. So we have patients who may come in, who have diabetes, high blood pressure, and may be uncontrolled, and I'm able to catch that and connect them to services so that those things are taken care of.
I came to the walk-in clinic because I was going through a lot and I needed some support. And I got it. Getting the medications and the help that I had got from everyone here, it had helped tremendously. I'm working again. I have my friends back in my life. My family is around. It doesn't compare to other places I've been. This is top tier compared to anywhere else I have been. It helps me every day to know that I have support.